Opicapone is a COMT inhibitor, which is used for Parkinson disease as well. It was developed by BIAL, it was developed in-house, and it's already on the market. So at the company, I work on the safety department. So our role is to try to identify if there is any safety issue with our drugs. And based on that, we usually perform a signal evaluation. So we try to detect if there's any safety issue, any safety signal, and as we regularly do that. So what happened is that recently we did an internal evaluation for psychiatric symptoms, and in this case, these psychotic disorders. This evaluation was done based on safety information that we received. So we have this global safety database for the drug, but we also performed some literature search, and we had a discussion with a psychiatry expert. And this evaluation was done internally, but we considered that it was valuable to share with others. So in the end, the signal, this safety signal was not confirmed, but this is also important information to share with healthcare professionals. So that's why we created this abstract, and we submitted to this Congress, and we are presenting here. And the main conclusion, so we had a look at the cases associated with psychosis. We extracted those cases from our database. So we had a thorough look at all the information, all the other drugs those patients were taking. And we had a psychiatry expert involved, and she was also looking and trying to see if she considered that was any kind of relationship between those events and the drug, Opicapone. And in this case, we find that in the end, most of the cases we could not establish any relationship, so there could be other factors. And our main conclusion after reviewing these cases is that it does not seem to exist a causal association between taking Opicapone and those kinds of psychotic disorders, because we also know they are common in Parkinson disease patients. Nevertheless, this is something that we continue to do, so we are always looking at our drugs and their safety profile. So in the future, we are going to continue to have a look and see if there's any kind of association, or if we still look and see a good benefit-risk profile of the drug. Yeah, I think this can help healthcare professionals because, for example, in this case, we know that sometimes these kind of psychiatric symptoms are also associated with other Parkinson's medications, for example, with levodopa, other medications. And in this case, for us, by showing that it seems that it's not related to Opicapone, or that so far we have not data indicated that it is associated directly with Opicapone, physicians can have a look and try to see, for example, the other drugs the patient is taking at the same time might be involved on those symptoms. So this type of information is also very useful for the consultations, for the physicians, for their daily activities, and the way that they manage the medications and the way they look at the patients. In the end, what is important is that, because I work at pharmacovigilance, for us having this kind of information, having these safety reports from physicians, from authorities, is a great source of information for us to do our work. And in this way, by presenting in the Congress, we try to return this very important information back to the healthcare professionals.